USMLE style question on Fragile X syndrome. Question: a 5-year-old boy is brought to the clinic due to concerns about developmental delay and behavioral issues. His parents report that he has language delays, including limited speech, and exhibits repetitive behaviors such as hand flapping and repetitive speech. His mother also notes that he has poor eye contact and is easily overstimulated in social situations. Physical examination reveals large ears, a long face, and macroorchidism, enlarged testes. There is no family history of similar symptoms. Which of the following is the most likely underlying genetic defect in this patient? A. Trinucleotide repeat expansion in the FMR1 gene. B. Mutation in the DMPK gene. C. Mutation in the CTFR gene. D. Mutation in the SHANK3 gene. E. Deletion in the 22q11.2 region. Answer and explanation. Correct answer: trinucleotide repeat expansion in the FMR1 gene. This patient most likely has Fragile X syndrome, an X-linked genetic disorder caused by a trinucleotide repeat expansion, CGG repeats, in the FMR1 gene located on the X chromosome. This leads to methylation and silencing of the FMR1 gene, which results in deficiency of Fragile X mental retardation protein, FMRP, a protein essential for synaptic development and plasticity. Pathophysiology: the CGG repeat in the FMR1 gene is unstable and can expand in successive generations, leading to anticipation, earlier onset, and more severe symptoms. The expansion results in loss of FMRP, causing intellectual disability, language delay, and behavioral abnormalities. Key clinical features of Fragile X syndrome: developmental delay, particularly in speech and language; intellectual disability, mild to moderate; behavioral issues, autistic-like features, e.g., hand flapping, repetitive speech, poor eye contact; hyperactivity, impulsivity, and social anxiety; physical features, large ears, long face, macroorchidism, enlarged testes; family history, often a family history of intellectual disability or similar features, especially in males. Why not the other answers? B. Mutation in the DMPK gene. Incorrect. This mutation causes myotonic dystrophy, which is characterized by myotonia, muscle weakness, and cataracts, not the behavioral and intellectual symptoms seen in this case. C. Mutation in the CFTR gene. Incorrect. This gene mutation causes cystic fibrosis, which presents with pulmonary and gastrointestinal symptoms, e.g., chronic cough, failure to thrive, not developmental delay and behavioral features. D. Mutation in the SHANK3 gene. Incorrect. This gene mutation is associated with Phelan-McDermid syndrome, which presents with autistic features, but it does not lead to the classic physical features, e.g., large ears, macroorchidism seen in Fragile X. E. Deletion in the 22q11.2 region. Incorrect. This causes DiGeorge syndrome, which is associated with cardiac defects, hypocalcemia, and immune dysfunction, not the specific intellectual and behavioral features of Fragile X. Key USMLE takeaways for Fragile X syndrome. Cause: trinucleotide repeat expansion, CGG repeats, in the FMR1 gene. Symptoms: developmental delay, intellectual disability, autistic-like behaviors, large ears, macroorchidism, long face. Inheritance: X-linked dominant, males more severely affected. Diagnosis: genetic testing, CGG repeat expansion in the FMR1 gene. Management: symptomatic management for behavioral therapy, speech therapy, and autism spectrum interventions. Would you like further details